Welcome everybody, with you Dr. Magdy Abdel, consultant of infectious diseases, hepatology and gastroenterology. Our topic today about syphilis. We will discuss causes, signs and symptoms, and also we will discuss the stages of syphilis. Syphilis is caused by the bacteria Treponema pallidum and is transmitted through sexual contact. It can be hard to diagnose, but without treatment, it can cause serious damage to multiple body systems over time. People have been treating, and surviving syphilis for hundreds of years. In fact, treatments are so well established that at one point it was thought possible to eradicate syphilis completely. Someone can have it without showing any symptoms for years. However, the earlier syphilis is discovered, the better is the result. Syphilis that remains untreated for a long time can cause major damage to important organs such as the heart and the brain. Understanding the symptoms and the causes of syphilis can help you protect yourself. If you do have syphilis, understanding this infection can help you to recognize signs of the condition and prevent transmission. So, who is the most at risk and what is the standard treatment for it are today? Causes of syphilis. Syphilis is caused by a bacterial infection. German scientists discovered it, which is called Treponema pallidum. The only way syphilis is transmitted is through direct contact with syphilitic chancres or sores. These sores tend to develop on or in the mouth, penis, vagina, anus. Syphilis is primarily transmitted sexually. That means you can contact it through oral, anal, or vaginal sex or direct genital to genital contact. Babies can contract syphilis if their mother has an untreated infection. This is called congenital syphilis. Syphilis can also be transmitted through blood transfusions, also that is extraordinarily source. You cannot contract syphilis by sharing a toilet, wearing another person's clothing, using another person's eating utensils. This is because the bacteria that cause syphilis cannot live for a very long time outside the human body. So anyone can contract syphilis. However, certain factors may increase your chances of contracting an infection. The following groups of people have an increased risk of contracting syphilis. People who have sex without barrier methods, like a condom. We also people with multiple partners, men who have sex with men, people who have HIV, people who have partners with syphilis. Stages of syphilis infection. The 4 stages of syphilis are primary, secondary, latent, tertiary. Syphilis is most infectious during the first 2 stages. When syphilis is in the hidden or latent stage, the disease remains active but often does not cause symptoms. Tertiary syphilis is the most destructive to health. Primary syphilis, the primary stage of syphilis occurs about 3 to 4 weeks after a person contracts the bacteria. It begins with a small round sore called the chancre. A chancre is painless, but it is highly infectious. People may not even notice when they have one. This sore may appear however the bacteria enters the body, such as on or inside the mouth, genitals, or the rectum. On average, the sore shows around 3 weeks after infection, but it can take between 10 to 90 days to appear. The sore remains for 2 to 6 weeks. Sometimes the only symptoms will be swollen lymph nodes. Syphilis is transmitted by direct contact with a sore. This usually occurs during sexual activity, including oral sex. Secondary syphilis, it characterized by rashes and sore throat, may develop during the second stage of syphilis. The rash would not itch and is usually found on the palms and soles, but it may occur anywhere on the body. Some people do not notice the rash before it goes away. Other symptoms of secondary syphilis may include headache, swollen lymph nodes, fatigue, fever, weight loss, hair loss, aching joints. These symptoms will go away. However, treatment is received. However, without treatment, a person still has syphilis. Secondary syphilis is often mistaken for other conditions such as psoriasis rosea, lichen planus, psoriasis. For this reason, syphilis has been known as the great imitator because the symptoms can be so non-specific. People experiencing symptoms may ignore them, or sometimes clinicians do not suspect the presence of the infection. Latent syphilis. The third stage of syphilis is the latent or hidden stage. The primary and the secondary symptoms disappear, and there would not be any noticeable symptoms at this stage. However, the bacteria remain in the body. This stage could last for years, but before progressing to tertiary syphilis. Tertiary syphilis, this is the last stage of infection. About 14 to 40% of people with syphilis enter this stage. Tertiary syphilis can occur years or decades after the initial infection. Tertiary syphilis can be life-threatening. Some other potential outcomes of tertiary syphilis include blindness, loss of hearing, mental health conditions, memory loss, destruction of soft tissue and bone. Also neurological disorders such as stroke or meningitis. Also heart disease. Neurosyphilis, which is an infection of the brain or spinal cord, may also occur. However, syphilis can be diagnosed. If you think you might have syphilis, go to your doctors as soon as possible. If you prefer, you can also use local health clinic for testing. We can take blood sample to run tests and also conduct a thorough physical examination. If a sore is present, we can take sample from sore to determine if the syphilis bacteria are present or no. If the infection is present, we can give you the proper management, and the penicillin give very good results. Thank you very much.